Hi, everyone. Dr. Westman here. I wanted to pop on for just a little while. This is our diabetes class enrollment time. We're actively enrolling at adaptyourlifeacademy.com for the first type 2 diabetes reversal course that we've given. We're really excited to be able to roll that out. And so I'm going to be talking about how to lower your blood sugar without medications. Of course, diabetes is defined by an elevated blood sugar. So this is directly related to diabetes, to prediabetes, and anything that has to do with insulin resistance, that has to do with blood sugar. So I want to just wait just a moment. Hi, Suzanne and Darlene, Frank, Daniel, Iris, James, Cheryl. Thanks for looking in. The Toberman 1, Central Wisconsin, Alfred from Houston, John from Illinois, thanks for looking in. And Carol, yes, Jane from Brazil, Elicio from the Philippines, wow. Amanda from Michigan, Tam from New York City, Ithaca, Irvine, Nashville. Wow, great reach. Thanks for chiming in, watching on the live, and this will be put up on a replay. So welcome if you're watching on the replay. So how do you look at blood glucose, blood sugar, and all? I'm going to be pretty basic, and then I'm going to get so complicated. It's so simple though. So complicated that your doctor isn't going to know the answer. Your doctor, even endocrinology professors, have come up to me after I give a talk and say, I never thought of it that way, thought of diabetes that way. So first of all, you have to know the names of things, right? So glucose is really what we're measuring when we talk about blood sugar. So you're going to hear me, just because I like to talk in both the professional language and in the general person language, you're going to hear me toggle between glucose and sugar. If I say blood sugar, I really mean blood glucose. So when you're checking the blood sugar here, or checking with a continuous glucose monitor, or when the doctor checks it at the vein, if they do it, you're measuring the glucose. And the glucose is a molecule that fuels cells. In fact, there are only a few cells that really need glucose. Glucose is not the primary fuel for the human body, even if you're eating a super high carb diet. Fatty acids are the most common and highest utilized energy source. And so ketones substitute for glucose. That's why we talk about a keto diet, but still that we're talking about fats being the primary fuel source for most people anyway. So that's why glucose is important. It is fueling cells like the red blood cells. Red blood cells have no mitochondria, have no nucleus, so they have to run on glucose. The mitochondria is where the fats are burnt and ketones. So if a cell doesn't have the mitochondria, it must use glucose. The other cell that needs glucose to function properly is the white blood cell, the one that fights infection. And it's no surprise, if you have an infection, the blood glucose will go up, because the glucose is helping the cells fight the infection. So it's a normal response to have the blood glucose go up to fight infections. Glucose is also affected by other hormones, not by just what you eat, but by stress hormones like cortisol, like adrenaline. If you're scared and you're running away from something, the adrenaline or epinephrine goes up and the blood glucose can go up. First thing in the morning, dawn phenomenon, is a hormonal response. The glucose goes up in response to the cortisol and growth hormone rise in the morning to get you prepared for going from lying down to getting up and around. a very small elevation in blood sugar in the morning called the dawn phenomenon is really nothing to be concerned about. If you want to look at the entire day, the A1C is a reflection of that if you're worried about that dawn phenomenon thing. But so the glucose will go up and down depending on lots of different things. The most potent factor in the diet, the most important factor in the diet, though, to raise the blood glucose, the blood sugar, is, no surprise, sugar. I mean, I laugh because there are people who say they're credible and they've been trained in major universities and on panels and all that say that eating or drinking sugar doesn't have any relationship to diabetes. Well, that's, in the words of a friend of mine, bull hockey. Come on. So diabetes is a problem of elevated blood glucose, and you can reduce your blood glucose by cutting out the sugar and the starches. Oh, so starches get digested to glucose, so they'll raise your blood glucose too. So sugars and starches are the main element in the diet, what we take in, that will raise the blood glucose. Sugar is found in so many different things added to foods that you have to be really careful if you're trying to lower your dietary contribution to your blood glucose. So if you have an elevated blood glucose and you're called pre-diabetic or you have diabetes or you're on your way there, you wouldn't want to be eating or drinking much sugar. And the sugar, yes, so fruit, now I try to keep things pretty simple. Fruit has fructose and glucose, and that disaccharide, the two sugar molecule, is called sucrose. So I don't want you to be confused about, is it sucrose, is it glucose, is it fructose? Well, sucrose has fructose and glucose. But the main thing is, if you measure the blood sugar after eating a piece of fruit, your blood sugar goes up. So I make some simplifications for teaching in that regard. So a carbohydrate measured on a label or on your Google nutrition facts or in a book, or you can, hey Siri, how many grams of carbohydrate in an apple? Siri was listening. Total carbohydrate in an apple per cup is 15 grams. These things are amazing. You can look up the carbohydrate content of anything by just talking to your phone, or it might be OK Google or something like that. Anyway, so, or you just stick to a list of foods that we have that keeps all of the sugar super low. But so how low do you have to go on the dietary carbohydrate? How low do you have to go on the sugar and the starches? And it's an individual thing. You may see somebody eating lots and lots of carbohydrate, not worrying about candy and ice cream and pasta and rice and fruit and all this, and they never have diabetes. They never get diabetes. It's pretty amazing that we don't all develop an elevated blood glucose with what most people are eating. But what's going inside the body, what's going on in the bloodstream, is when you eat carbohydrates, the blood glucose goes up. And the body doesn't like the elevated blood glucose. Remember, if the blood glucose is elevated throughout the day for a period of years, you get the complications of diabetes, which is the blindness, retinopathy, the heart disease, the vasculopathy, the kidney disease, that's the nephropathy, the numbness and tingling in the toes, that's the neuropathy. And if our mainstream medicine treatments of, well, just eat carbs and we'll give you medicine for it, if those totally eradicated the downstream problems of kidney failure and neuropathy, I wouldn't really be here. I wouldn't be needed. But our mainstream medical approach of not worrying much about what you eat and just giving you medicines has not solved those downstream problems. So if you're not following a low carb diet yet, that's fine. Just talk to your doctor. If you have diabetes and you're being treated for it, ask them what your prognosis is. How likely are you to get kidney failure, heart disease, neuropathy, even when you're treated and managed with medications? The risk is not zero. It may be reduced by these medicines, but it's not eliminated. I prefer to direct people toward another path where you actually eliminate the diabetes. So back to how low should you be on the dietary carbohydrate, the sugars and the starches, in order to keep the blood sugar down. And I'm not going to add in any information or ask anything about supplements. Supplements, sure, some of them lower the blood glucose, but if you don't test out a super low carb diet, then, well, if you do a super low carb diet, there may be no need to add in these extraneous supplements. And that's my goal, is to teach you a method of keeping the blood sugar way down so you don't need medication or even nutritional supplements. So here is the little known, yet staring us in the face, reality of how much sugar, glucose, there is in the bloodstream. If you calculate, if you take your blood glucose measurement, a normal one, the high level of normal is 100. In our units, it's 100 milligrams per deciliter. And you multiply out milligrams per grams, deciliters per liter, and you are now given the information that there are 5 liters of blood in the human bloodstream. That's for an adult. In a child, it's much lower. You calculate all this out. There's 5 grams of glucose in the entire human bloodstream at any given moment. 5 grams. That's a teaspoon of sugar. Not even a heaping teaspoon. It's a teaspoon of sugar in the entire blood. So this is the system that we're dealing with when it comes to diabetes. If the blood sugar goes up, if the total content is more than 5 grams, insulin is sent out to lower the blood glucose by putting the glucose into the cells. Turns off the fat burning and turns any extra sugar into fat, sends out to the fat cells. So we're dealing with a very, how should I say, fragile or sensitive system, only 5 grams in the entire bloodstream. Now you might say, well, what does that mean in reality? Well, remember that apple? A medium-sized apple has 15 grams of carbohydrate. So if you eat an apple all at once, and it gets absorbed all at once, or it might take a half hour, you're putting 3 times as much glucose into your body. Well, let's just say carbs and sugar, because it's technically half, because it's fructose and glucose. Anyway, I don't want you to get overly concerned about the details. Let's say you're putting in twice as much sugar as in your body bloodstream at that moment. So it's no surprise if you don't have insulin going up immediately, or you have insulin resistance, which goes along with type 2 diabetes, your blood sugar after 1 apple is going to go up. It might even go from 100 to 150. Just 1 apple. And I heard someone, I hope you watch my YouTube channel, it's Adapt Your Life or Dr. Eric Westman YouTube, because recently there was a doctor who was shocked that you wouldn't tell people to have an apple a day because it keeps the doctor away. And if you're trying to reverse type 2 diabetes by using a low carb diet, you don't want to have an apple, because that can double your blood sugar. Now, what I do is I line up all of the foods, and what I do is I just focus on the foods that have very little sugar in it. Tell people to eat foods that have no carbs at all. Remember, carbs is the simplification, and it's total carbs, not net. We're not subtracting out fiber and sugar alcohols. The strict prescription strength diabetes reversal kind of low carb keto diet uses total carbs, not net. So 20 total carbs for the day or less is where you want to be. And then you're not going to get that blood glucose elevation, the insulin elevation. And insulin is the fattening hormone. It turns off the fat burning, turns sugar into fat in the liver. Thus, you get fatty liver from eating an apple, from carbs. And in my simple system that we've used, that we've studied and published and now taught people thousands of times over the internet, is one where we give the foods that are really low in carbs, and you choose from those foods. So you don't even have to be asking Siri how much how much carb is in the food. We make it simple for you to stick to the foods that don't have the carbs. So you might say, well, I don't know about these other foods. Well, for example, a lot of people come in thinking that fruit is great, it's healthy. It's not healthy in the context of a low carb diet when you're trying to reverse diabetes. So that's the compromise of, well, under other conditions, these foods can be healthy, sure, but it's not going to help you lower the blood glucose and insulin. And if you're trying to do that by diet alone, apple has roughly 15 to 20 carbs, a banana 30 carbs. So here's your cupful, which is about a fistful, half a cup, a quarter cup of berries or fruit has 5 carbs. So even a quarter cup of berries has the same amount of sugar that's in your bloodstream at any given moment. Do you want to eat a quarter cup of berries that will raise your blood sugar maybe by 100 to 150? No, not me. So I recommend no fruit, no berries. Very different than the internet keto that you might have seen. Other sorts of things that may not be obvious, these products out there that say keto on them, they're not necessarily low enough in the carbohydrate to be useful to reverse diabetes or to be effective. So I've seen lots of people fall victim to the keto bread, the keto ice cream, the zero net carbs, great for keto diets. Be very suspicious. Always look at that label, or always ask Siri how many grams of carbs are in a Atkins chocolate bar. It only gives 2 to 4 net carbs, but I don't want to know net carbs. I want to know total. So if I have the product, I'm at the store, I know that those bars have about 20. Now, if you purchased a whole bunch of them, you just cut them in fourths, have one every day. That would be 5 carbs. So there are ways to get around this, but what we're trying to do is reduce the food contribution, the drink and food, to raising the blood sugar. Another common issue is people thinking they need to have juice or some other sugary thing. What am I going to take my medicines with, for example? Well, you take it with a piece of cheese, or there are some diet juices out there that are pretty tasty. And all you do is look at the nutrition facts label in order to look at total carbs, not net, and then that will give you an idea of how much it will raise your blood sugar. Now, you could just take the list of foods that we have and take my word for it. There are a lot of people who politely listen to me and then they go out and get their own glucose monitor. There are ways to measure your own blood glucose. The one that's out there that measures the glucose and the ketones that I think is a good product is called the Keto Mojo. But I don't make people, or I don't even recommend that people go out and measure, but people do. And because if you just stay to the list of foods, the blood sugar is not going to go up from that food. The other way to monitor today, a lot of people use a continuous glucose monitor. These are little disc-like things that go on your arm. It's painless to put one on. I wore one for a while, and it gives you every 5 minutes a reading of your sugar. Well, it's not exactly the blood sugar, but it's really close. So the Libre 3, the Dexcom, these are all one brand names, and hopefully they'll go over the counter soon, so you don't need a doctor's prescription to get them in the US. It's a game changer for a lot of people, especially if you're, you got to show me, you can't trust what people say. You get one of these and you'll see that after you eat carbs, blood sugar goes up, and it doesn't take many carbs. So even in the vegetable realm, if you have potatoes, even sweet potatoes, these will raise your blood glucose, because a potato has something like 40 carbs per cup. The rice, the potato, these are really, really high. And yeah, even brown rice, even sweet potatoes. I've heard people say, what, no bread? What about whole grain bread? No, even whole grain bread. Just look on the label, look at the total carbs, and that will guide you. Now, per meal, if you can get the carbs down to 5 or so per meal, that's going to be great. Remember, it's about 5 grams that raises, well, 5 grams that we have in our bloodstream. So if you get 10 carbs per meal, you're going to go up 15, 20. So for the whole day, our prescription strength diabetes reversal diet keeps you under 20 total carbs for the day. That may seem low, but the little secret that if you've never done this before, the secret is if you rip the Band-Aid off all of a sudden, it doesn't hurt. So if you cut all the carbs out all at once, you might miss them for a day or two. It's remarkably fast. The cravings go away, the hungers go away, the blood sugars come down on the first day. So now if you're watching and you're eating, well, I don't know, 200 carbs a day, like most Americans, and even some diabetology teachers say you need 35 or 40 grams per meal, and you're on medicine that's titrated to that blood sugar, you have to be very careful. If you're cutting the carbs down, you need to cut the medicine down on that first day. In fact, we help people do that, and we help you understand that in the course that we're offering at Adapt Your Life Academy. And if you don't know how to do that, you must be super careful and do this with a doctor or practitioner who knows how to help you do it, to de-prescribe the medications. It can happen very fast, and it can risk a low blood sugar before you know it. And you can pass out, and it can be life-threatening with a low blood sugar. Now, if you're only on pills or you're pre-diabetes or anything, then this is super easy. You don't need to be monitored carefully by a doctor. You just follow the blood sugars, and the blood sugars will tell you. And when the blood sugars start to get into that normal range, 80 to 100, you're not going to need the medicine anymore. It's actually kind of obvious when you're measuring it that carefully. So how powerful can this be? I've had people come off hundreds of units of insulin in a matter of days to weeks. And why it goes so fast kind of depends on how much carbohydrates someone is eating or drinking. And in the cases where people are drinking sugar, yeah, some people still drink Coca-Cola, Pepsi, I don't mean to call out any certain brand, but any sugary beverage is going to, at last look, a 12-ounce regular sugar-sweetened beverage has about 40 grams of sugar in it. That's what? Divided by 5, that's 8 teaspoons of sugar. That's 8 times as much sugar as you have in your bloodstream at any given moment. When you drink one of those beverages, your blood sugars are going up, the insulin goes, it must be like a battle inside to keep it down. And it's amazing that not everyone has diabetes drinking that stuff. To me, it just shows the wonder and the flexibility of the human body. You know, if you drink those things and you're healthy, it doesn't apply to you. But if you are getting pre-diabetes and diabetes, I don't think you should drink sugar in any way. And if you're in the southern United States, that means tea, no tea, which in the southern United States means sweet tea. You had to learn that quickly when you moved from the north to the south. So no sweet tea. Fortunately, there are flavored teas that match that flavor of sweet tea pretty well. And so I use that a lot to help people off the carbs, the sugars, to use substitutions like the alternative sweeteners to sugar. They're very helpful because they don't raise the blood sugar. They don't get that same effect. Now, so cutting the food and drink contribution to the blood sugar is extremely powerful. And you can have blood sugars that are abnormal go into the normal range just by doing that. On the other hand, if you have a lot of abdominal obesity, which leads to insulin resistance, even when you cut all of the blood sugars down cut the contribution of the food and drink down, you might still have elevated blood sugars. And that's because insulin resistance makes the insulin not work as well as it should, even when you're not eating carbohydrates. So in one case recently, it took 8 weeks for this person to have normalization of the blood sugars, even when not eating carbohydrates. Another person recently, it took 1 week for all of the blood sugars to normalize after not eating carbohydrates, because the weight, the abdominal obesity, insulin resistance contribution to the elevated blood sugar was relatively mild. I've had some people who it takes a year for the blood sugars to normalize, even when you're eating a low carb diet, because the contribution of the obesity was making the blood sugar go up. So if you have a 100-pound weight loss journey and have diabetes, it might take 50 or 100 pounds of weight loss to get that insulin resistance resolved. Now, just as kind of a warning, there is a clash of paradigms here, and I've treated people who are on low carb diets. They're not perfectly controlled. Let's say the blood sugar is in the hundreds, or 6 to 8 in millimole in the 100 to 200 range, and you might end up going back to your old or the old paradigm doctor, and they'll say, "Well, your blood sugars aren't normal. You need to go on medicines." So there's a period of time where if you go back to the old paradigm, you're put on medicine again, you might be put on insulin again, and then you start gaining weight again, and you're going to have diabetes forever now because the insulin doesn't reverse it. It makes it, it actually just causes more insulin resistance. So there's a period of time where you really have to focus on this approach, be patient, talk to the practitioner that's helping you. Don't get sucked back into the, well, in this case, I was thinking of the blood sugars were better than before, but the doctor that they went to didn't remember. So you have to advocate and say, well, look, doctor, when you had me on twice the amount of insulin, my blood sugars were twice as high, even on more insulin. And I was gaining weight. At least now I've lost 50 pounds. My blood sugars are better, even though it's not perfect yet. You may have to remind the doctor that it's much better than it was before, because there's this kind of false expectation of perfection among the doctors today, well, anyone today. And so as you're reducing and reversing type 2 diabetes, if it doesn't automatically reverse with the diet and lifestyle food change, it may take more weight loss to get that normalization. So here's a little quiz. How many carbs in the bloodstream? How many grams of glucose? 5. How many grams of glucose in a teaspoon of sugar? 5. How many grams in a quarter cup of fruit? 5. Fruit or berries. How many grams in a light beer? 5. Yeah, so actually you can have any of these things if you only have that much for the day, to stay under 20 for the day. And I remember someone coming to my office to learn how I do things, and afterwards he said, "You teach people how to cheat." And I said, "What do you mean?" They're still under 20 total carbs and they're able to eat things they like. So some of these products that have yogurt and little pieces of fruit at the bottom are fine, because the fruit is the amount is very, very low. It might have 2 grams of carbohydrate, and that's not going to impact the blood sugar much. Remember, there's only 5 carbs, 5 grams. Now, as a test, this would be pretty. Now, I don't want you to make your doctor mad, but you might ask, "Gee, doctor, how many grams of glucose is there in the bloodstream?" And if they know, I would be shocked, because again, I've given grand rounds, which are the lectures we do among the medical world at universities, called grand rounds. And endocrinology professors would come up to me. These are experts in the drugs. And so there's a big disconnect in the medical world. You can be a world expert in diabetes and the drugs and really not know much about the food. In fact, there's so much happening in the drug world for diabetes. I know a lot more about the food treatment of diabetes than all of those different drugs. I'm trying to keep up on it. Many of these drugs are just too darn strong, and people don't want to eat at all. And so I just came back from our Obesity Medicine Association meeting. I gave a talk there on the keto diet. It was in a group of talks about the keto, the Mediterranean, and the plant-based diets. It was having fair and balanced sort of teaching at this meeting. But these medical weight loss doctors are pretty much enamored with the drugs, the pills and the shots. And now there's a it's difficult to get them. So don't forget that the dietary management of obesity and diabetes goes back 100 and 150 years. And so let me tell you just a little story about how I learned about much of this. And it was from one of my patients. So I'm trained I was an undergraduate at Stanford University, a history major. So I wasn't a bio major, but I had to take biology. Went to medical school at the University of Wisconsin in Madison, residency in Kentucky at Lexington, the University of Kentucky, and then a fellowship at Duke University, where I've been for the last 34 years now, since 1990. And so in my ambulatory care practice at the VA, I worked with the Durham VA for 10 years. I like the VA as a model, generally. One of my patients came in and said, Dr. Westman, I know you're kind of a history buff. Well, I was a history major anyway, and I like to travel and look at the medical museums whenever I can. I remember in Austria, I looked at the basin of Ignaz Semmelweis, at least that's what they said it was. It was his, where he had people wash their hands for the first time, knowing because they didn't know about germs. The germ theory wasn't there yet. So anyway, this patient came in. I thought this might be helpful. I'm a used bookstore owner over in a neighboring town, not in Durham. And this is it's a textbook of medicine from 1923 from Sir William Osler, which is the father of internal medicine. So I'm in my first study on the low carb, it was called Atkins at the time. And there was someone actually complaining that we were studying the Atkins diet to the director of the hospital. So I was getting a little flack where I really didn't know what I was getting into. Doctors don't have training in this generally. And I thought, well, 2 of my patients lost weight with an Atkins diet. Let me study it. That's what I learned from many different doctors, including Dr. Atkins, how to implement it. And so the patient showed me this book. And I thought, well, thank you so much. She wrote her name in there, which is quite nice. And I look at that book, 1923, The Treatment for Diabetes. So this is 1999. I'm in the middle of a study telling people not to eat carbohydrate, getting grief from, it turns out, a dietitian and a plant-based director of a hospital, like spiritually and religiously, not scientifically. Then in there, the treatment for diabetes in 1923 was 10 grams of carbohydrate. And it lists the strict diet is meat, poultry, fish, gelatin, butter. It was one of these moments that I'm getting flack about a diet that I'm studying when it was what all the doctors used 80 years before, or 70. Well, actually, I was able to handle the first edition of the Osler textbook of medicine, which at the time was at McGill University at the Osler Library in Montreal. They bring the book out and you put gloves on and you handle the book, and they watch over you so that you're not, ruining the edition. Remember those things called libraries? I still love them, and old books. But so the, kind of the coincidence of that, of being reminded by one of my patients, without her really knowing, because I looked up what did doctors use in 1923 to treat diabetes or obesity, and it was the study that I was doing. So at least it gave me some reassurance that it wasn't so crazy as everyone said it was. And I learned about the 5 grams of sugar in the blood from a doctor who was blogging at the time. You may remember the book Protein Power. Mike and Mary Dan Eads were general practitioners family practitioners in the Midwest, and they used low carb diets and had Protein Power, and now they're friends, and they've done a course for us at the Adapt Your Life Academy. But they wrote for where I saw it the first time, Mike Eads was writing in his blog that there's only 5 grams in the blood. So I wrote a paper on that just a couple of years ago, got it published, and then I found later that there was another scientist who wrote a similar article basically saying there was 4 grams of sugar in the bloodstream. So 4 or 5. Yeah, it depends, also on how big the person is. You can actually get a calculator to see how much blood there is in a baby. There's much less blood. And so there's going to be much less glucose in a baby or a child. So it's even worse if you pour in all of this carb into a smaller human. It's going to have a higher effect on the blood sugar. And so I have this kind of recurring thing that I'd like to listen to people, including my patients. And I've learned not only about low carb diets, I've learned about the treatment of diabetes. I've learned about the management of the issues that come up. And I learned from other doctors who actually worked all this out. And my role, in my group role at Duke, was really just to formalize it into clinical research and publish papers on using a low carb diet for various illnesses. Recently, the paper we did on irritable bowel syndrome, diarrhea predominant, published in 2009, was recapitulated into a randomized trial and published this year, 2024. So 15 years later, after our paper, it was redone in a better, more certain way, but it takes a lot of money to do these studies. Dr. Atkins wrote in his book in the 1980s that he could fix irritable bowel syndrome, diarrhea predominant, but no one would believe that. I didn't believe it either until we started using it and then writing papers and publishing on it. And the difference between our studies and the other low carb research studies is that we actually went to doctors and asked them what they were doing. I'm a son of a doctor. I saw him, my father had a wonderful clinic at a university, and over the years he learned so much and retired, and the clinic couldn't really be replicated. But so I guess I valued that a clinical doctor through a lifetime of experience could learn things, whether there were publications or not. And the main basic fundamental biology of there being 5 grams of sugar in the bloodstream is lost in the teaching of dietitians, of doctors, of DOs. So this is something I'm afraid you're now the smartest person in the clinic if you go in knowing this. But again, don't take my word for it. Check your blood sugar. If you can't, don't believe me. Which is a funny story. I never really had checked my own blood sugars or ketones. Don't really follow them, but there are a couple of young doctors in my area where the doctors themselves have been wearing glucose monitors for years through residency and training, and they've learned that they don't eat many carbohydrates, but if they go for a walk after they eat, they might be able to have some dessert and the blood sugar won't go up because they go for a walk. It's like they're recapitulating all the old sort of lore that we used to say, So I thought, well, gosh, if they're wearing the glucose monitors all the time, I think maybe I should. And so I went out and got a glucose monitor. If you don't have diabetes, it might be $50 for 2 weeks or $100 for a month. If you pay for it yourself at the pharmacy, you still need a doctor's order, although the word on the street is that it will go over the counter, so you don't need a doctor's order pretty soon. But so my blood sugars at the beginning of the month were 80s and 90s, like I was following the list of foods that I follow. But what happened over the month is I was thinking, well, I wonder if I can have, that quarter cup of berries, or I wonder, can I have that just half of one of those chocolate croissants I learned to like when I was in France in college, So by the end of the month, my blood sugars were a little higher than they were at the beginning using the CGM, because I wanted to test things. And so, on balance, the A1C, which is hemoglobin A1C, which is the average of all your blood sugars, didn't really change much, because when I ate something, it didn't have much um, much sugar in it or starches. So anyway, be careful if you're testing all the limits all the time. Just don't eat the carbs, especially when you're trying to reverse diabetes. If you have a lot of weight to lose, you have a long weight journey, it's best to just get all of them out and to not have the cravings, like taking the band-aid off. The hunger and cravings are gone really fast, just in a day or two, maybe a week for some people, but it's really a quick resolution. And you won't believe it if you haven't tried it. I mean, that's okay. Nobody has taught you about the 5 grams of glucose in the sugar until now. And no one has taught you perhaps that it's the carbs that make you hungry. And you wouldn't know that until you cut all the carbs out, because just a little bit of carbohydrate can make you hungry. So, that's the main thing I wanted to talk about. The class that's now open at Adapt Your Life Academy, and I am supposed to put up a little thing at the bottom here to show you where you can go to learn more about the class. It's open for enrollment now. We teach just what you need to know about blood sugar and insulin, and give you the list of foods. And even for those who are on medications, I decided to have a section to help you understand the medicines and to work with your doctor to de-prescribe them, because often that happens really fast. So we're really excited about bringing this type 2 diabetes course out. At the Adapt Your Life Academy, we've taught about the keto diet just by itself for obesity treatment and other diseases. This is our first class that has to do specifically with type 2 diabetes. In fact, there's another class that had addressed type 1 diabetes. That's not this one. This is the type 2 diabetes class. And as you see, I try to make things as simple as possible, but it has to be effective. And the major little secret that you now know is the key to effectiveness for controlling the blood glucose without medication is to understand that there's only 5 carbs, 5 grams of sugar total, not net, in the human bloodstream at any given moment. So you want to eat accordingly low compared to that 5 grams. Hope that's helpful, and I hope to see you inside the course and at the Adapt Your Life Academy. Check it out. We're so excited. I have a great team that we put together that's now, for years have been helping people with teaching this and helping them get started with this kind of approach. And there's really nothing else like it. So take care now. Bye-bye.